Hi everybody, today I'm going to talk about the deep anatomy of the ACL on the MRI of the knee. So I'm going to talk about the double bundle concept of the ACL. That's the way that professionals see this anatomy, how the orthopedic surgeons see this anatomy, how the musculoskeletal radiologists see this anatomy. So let's talk about this right now. And here we have the two bundles of the ACL, the anteromedial bundle in red and the posterolateral bundle in blue. The femoral footprint has a vertical direction with the knee in extension. I'm gonna describe this anatomy with the knee in extension because that's the way that we see the MRI of the knee, how the MRI is done, okay? So that's the femoral footprint. The tibial footprint, it has a more horizontal direction, and it explains this difference of the vertical direction of the femoral footprint and the tibial footprint that has a more horizontal direction. It helps to explain why the two bundles of the ACL, they twist around themselves in its course on the knee. Okay, so talking about the femoral footprint, talk about the specific areas of the femoral footprint of the anteromedial bundle and the posterolateral bundle. The area of the femoral footprint for the anteromedial bundle is higher and anterior in comparison to the area of the posterolateral bundle that is lower and posterior, and I'm gonna show you that on the MRI of the knee in a few seconds. Okay, about the tibial footprint, the anteromedial bundle, it is anterior and medial in relation to the posterolateral bundle. By the way, the name of the bundles, they were given based in this relationship of the insertion of the bundles at the tibial footprint. So that's why they have these names. So now I'm going to talk a little bit more about the femoral footprint. And the femoral footprint of the ACL is located at the internal and posterior region of the lateral femoral condyle. It's an ovoid area, and its anterior boundary is this lateral intercondylar ridge, or the residence ridge, and it's divided into by this lateral bifurcate ridge. Okay, so in this superior and anterior portion here with the knee in extension, that's the area of the anteromedial bundle footprint, and this region right here in the posterior and inferior portion of the femoral footprint, that's the area of the posterolateral bundle footprint. And here, talking a little bit about the tibial footprint, we can notice that this area here of the tibial footprint of the ACL, so the tibial footprint of the ACL is this area here in orange, and in this area here in green, that's the anterior lateral meniscal root ligament. And we can notice this anatomic feature here. There exists an ACL intrusion onto the anterolateral meniscal root ligament that can reach 63.2% of the root attachment of the lateral meniscus. So they are kind of roommates, the ACL and the anterior lateral meniscal root ligament. And especially this area here is the area of the insertion of the posterolateral bundle of the ACL. So the anteromedial bundle insertion occupies an anterior and medial position, and the posterolateral insertion occupies a posterior and lateral position in a close relationship with the anterior lateral meniscal root ligament. So, and one interesting fact is that the size of the tibial insertion is approximately 120% of the femoral footprint or the femoral origin of the ACL. So it can help to explain why lesions of the proximal ACL are more common than lesions of the distal ACL. Okay, so another interesting thing is that there is not such a central insertion of the ACL. Generally speaking, speaking, the tibial footprint, it has an hourglass shape, which is better to dissipate energy, and that also helps the ACL to be less vulnerable on on its distal third, on its tibial insertion in comparison to the femoral footprint or the origin of the ACL. So a little bit more about the tibial footprint. The form of the tibial footprint is variable. It can have a C shape, a J shape, a double C shape. It can be elliptical. It can be triangular. So it's much more variable than the shape of the femoral footprint of the ACL. And here I want to show an example of this anatomy of that subbundal anatomy of the ACL. In red, that's the anteromedial bundle. Look, the anteromedial bundle, its origin, the femoral footprint, it is superior and anterior in relation to the posterolateral bundle. So look here, when you start seeing the ACL, you start seeing the anteromedial bundle in red, anteromedial bundle, and here you start to see the posterolateral bundle. So that's the anteromedial bundle, that's the posterolateral bundle, anteromedial bundle, posterolateral bundle, and we can see the two bundles of the ACL inserting on the tibial footprint. And look, the relationship between the anterior root ligament of the lateral meniscus with the posterolateral bundle of the ACL. We can see that better on the coronal plane. Here in the coronal plane, that's the anteromedial bundle of the ACL in red. That's the posterolateral bundle of the ACL. We can see again, we can appreciate this relationship between the meniscal root ligament footprint and the posterolateral bundle of the ACL. And here on the femoral footprint, we can notice that the origin of the anteromedial bundle is anterior and superior in relation to the origin of the posterolateral bundle. So coronal plane is a great plane to see the two bundles of the ligament most of the time. Axial plane is a superb plane to see the double bundle anatomy of the ACL. Also, the oblique coronal plane, it's also a good plane to see this anatomy. So here we can appreciate the anteromedial bundle of the ACL, and here's the posterolateral bundle. And look, the relationship between the posterolateral bundle and the meniscal root ligament. So they are roommates again. Here we can see that they insert partially at the same region, right? And so that's beautifully demonstrated in this case right here. So to finish up this case, I want to show you the sagittal plane. The sagittal plane, it's a great plane to see the whole ACL, to see if the fibers, they are straight, if the fibers, they are parallel to the intercondylar region right here. And we can also identify the anteromedial bundle here and the posterolateral bundle. This case, it's a little better to identify these two regions. And some other cases, it's not that easy. Easy to identify the two bundles on the sagittal plane. But sagittal plane, it's the best plane for you to see like the ACL as a whole. And actually, it's an important plane to evaluate the ACL together with the axial plane and the coronal plane. So here are some of the references that I used, that I dove in to make this video. And that's it. Thank you for your attention. Hopefully this video was useful. It'll be useful for you. And until next time.